Uh, yeah, good evening, guys. Good evening to all. Uh, I think few of the participants have not yet joined. Dr. Dolly has not joined. Anisha already informed to me that she's traveling. And Anil is another guy who has not joined. And there are a couple of others, I think, maybe joining in next 5-10 minutes. I understand that they need to return from their office back home. Okay. Uh, Before, shall we wait for another 2-3 minutes, or shall we proceed? Yeah, not Anjali, you are there. I'm asking about Dr. Dolly, Dr. Dolly Singh. Yeah, Samra join. Yeah, but I know who are missing because I know most of you. Okay, let's start. I mean, it's already 6:30. Yeah, Samrat also has joined. So, ladies and gentlemen and colleagues, I welcome you wholeheartedly to this third International Advanced Masterclass QARA sessions. Okay, and I want to remind you that it's not just a training program. Okay, it's more of an accelerator because most of you, maybe in later I'll show you the resistant analytics. Some of you are having 3 years experience, some up to 7-8 experience, and some are having more than 10 years experience. So based on your experience, okay, we can press the accelerator, okay, uh, mainly on the capability and credibility of it. Because I said that this program takes uh, viewpoint of view and also considers your experience, and we'll proceed based on, I will press the accelerator at what speed we want to go, looking at all other objective things. Uh, and I think I already shared with you uh, the total course content. I don't know how many of you have gone through that. But it is imperative that we need to discuss the course content and what we are going to study, or what we are going to get trained or practiced, and whatever ways we are going to do these sessions, because this understanding helps you to move further. As I have written in or text in WhatsApp, that we are going to a more advanced version of dealing with quality and regulatory in the due classes. Okay, in the coming classes, I'll make you understand like how advanced we are moving and what are the future directions. So what I'll be, I mean, there are three things which you need to understand. One is the current setup of like what's happening in the quality and regulatory. Okay, a regulatory concern of all countries or uh, global regulatory forms, and what's happening with quality currently. Okay, And the second important thing is what are the recent updates that have happened. Okay, some of you may be aware, some of you are not aware. Those who are aware may not be implemented this in your system or in your organization. Okay, and what are the other advanced or the future regulations that are coming in? Okay, both in quality and regulatory, which we need to be prepared. So what I'm making you to understand is that we need to be proactive, more predictive, okay, and that I'm going to deal a lot in all the sessions or all the chapters, how we can be predictive and proactive in all of the systems. And most importantly, okay, as there is a lot of, I mean, every hour there will be, I mean, it's not great to say or it's stupid to say every hour, but every day or every week there is some change in regulations, whether it's in quality or regulatory in some of the countries which we need to keep abreast. Okay. So, I mean, I will be doing this, but most importantly, you may ask me like why these master classes, what is the essence and what is the difference between the other QARA training sessions that Salvation Global is taking up. Okay. And what is the necessity of for taking these master classes in the last 2-3 months, or maybe I'll be taking another classes for the next 2-3 months also. Okay, these master classes and why now and why it is important and why is it essential. Okay, point one, we could see in the global medical device ecosystem. Okay, it's total ecosystem. It's not just quality or regulatory, it's all the innovations, supply chain. Okay, it is under continual transformation. Okay, it's not that you have a plateau or baseline, it's under continual transformation that is happening. Okay, we have seen recently because of the US trade tariffs what has happened to all the countries, including the manufacturing sectors in the medical devices. Okay, the supply chains, how it was disrupted, and in our country itself, how the GST has to be changed for medical devices into two slabs, all that. Of course, it includes other commodities and other goods and services, but we are focusing more on the medical devices, how the landscape has changed in the last 1 month. So there is constant transformation that is happening. Okay. And there will be, I mean, I can assure you that there will be a lot of changes that happens in the medical device ecosystem. And the reasons are, I mean, to my knowledge, the reasons are three. Okay, one is the speed of innovation. The speed of innovation is happening very fast, and we could see the speed of innovation, why it is, I mean, rushing or moving fast is because of the AI/ML platforms that are coming in. Okay. I mean, earlier it used to take 3 to 5 years for a new product to come in or a new device to come in, and another 2 years for the clinical trials and all the stuff. But because of the AI/ML platforms, which are creating a lot of prototypes, okay, 3D 3D printing prototypes very early, and the testing parameters happening, the testing and validation and verification happening very, very fast. So the speed of innovation is happening, whether it's AI or digital implants or instrument. So there is a rapid innovation that is happening, not only for new indications, okay, or not only for new devices, okay, there are some modifications that are happening in the existing devices, okay, and that too for new indications are increasing the performance of the existing devices, reducing the risk. But in the speed of innovation, what it's happening is it is outpacing the traditional regulatory models. Okay, we have traditional regulatory models or traditional regulations like what we had 2-3 years back. If you remember 2-3 years back, nobody spoke about AML or SOMED or SOINMED. But now these have come in. Okay, even the wearables are now connected to AI, I mean AI where they are integrated. So the new regulations are coming, but the innovation is outpacing the regulation. So it's very imperative for us to understand what the new innovations are that's happening and what are the regulations. Of course, what is the quality control measures that are required. So that I'll be updating you what are the current trends and of course in future what's going to happen with this. Okay. And the second point, apart from the speed of innovation, which is outpacing the regulatory models or traditional models, the second important thing is the regulatory strategies have become very stringent. Okay. And they are getting updated, as I said just now, they're getting updated every month or every week. Okay. Maybe, I mean, just as a reference, we have seen how the UMD is being paced. Okay, of course, it came in 17, but they are really on the ground or placed in 2021. Of course, because of the European Union complications of not having adequate supply chain, they have postponed it because of their internal issues to 25, 26. But the rollout plan is happening very, very fast. I'm just telling the example of EU. Okay. And also that's the same thing is happening in FDA, US FDA, it's happening in China. Okay. And there are a lot of changes that are happening in Brazil and Anvisa. Of course, in our own country, in India, you'll see a lot of, I mean, digitalized transformation, digitalized mainly in the adverse event reporting, you see, mainly in the submission of the technical files. There are a lot of changes that are happening and they have become very stringent and they are getting updated. Okay, this is the second reason where we see that the notified bodies, the FDA, Health Canada, there is a lot of, I mean, uh, what we say, I generally feel that regulations should regulate, but most of the regulations are strangulating that we are overpoured with, or we are just being stuffed with so much of regulations that it is becoming clogged or we are having asphyxia. But in this course, I'll make you understand simply simple ways, make you understand the simple ways of understanding these regulations. Okay, whether it's MDSAP or the global medical device regulations, okay, the regulatory strategy, how to follow. Okay, all this will make, because of late it's more on the risk-based evidence. Okay, lot of EQMS or electronic models are coming more than the paperwork. So that's the second thing. And the third important thing is that there is a lot of global harmonization. I'll stress on this point as we move towards the ISO 13485 or the MDSAP or the changes that are happening in the regulatory affairs. As of now, I mean, people are talking, can we build up a global technical file that caters to all the countries, not just for Europe or it's not for IMDR or it's not for UMDR, it's not for fighter cabinet. Can there be a global regulatory file? Okay, or global technical file that caters to the all the countries. Okay, as I said just now, because there is a lot of change in the exports that are happening. A lot of change in the exports uh, to the other countries. People are looking at more the Latin countries, Asianic countries, uh, and some are bypassing Europe. We'll see all this, but the global harmonization is happening basically because of the MDSAP in the QMS and IMDRF, okay, International Medical Device Regulatory Forum, that is making the global harmonization to have a single system of quality and single system of regulatory standards or the systems. So these three, okay, one is the speed of innovation, the regulatory stringency, and also the regular updation of the regulatory norms, and also the global harmonization. Okay, that is also leading to the digital pathway, and I have to make you understand this. In next 2 3 years, everything will move into a very digital pathway, whether you are doing the submissions or whether your QMS is going to be transformed to EQMS, and the communication system on your PMS or CR is going to be a digital system, something like you'll have a dashboards, okay, working instead of the what you call the traditional paperwork. So my point here is that because of the changes, it is important for us to understand what's happening. Okay, what are the changes that you need to take up in your organization? Okay, and to become appraise your management that these are going to be the current changes. Immediately, there are some which need to be done, and in the long term basis, what it has to be done. So compliance alone is not sufficient for companies or the manufacturers. At the end of the day, the credibility of the organization matters. So how quick and how fast can you move into the updated regulations? Okay, and how you can think, how can you be do some predictive analytics? Okay, like what's going to happen in after 3 years or after 5 years? Are you prepared now? Are your organization prepared now? At least you are aware of it, self-equipped with it, so that immediately you can jump into that instead of wasting so much of time, okay, trying to understand that. So all these things I'm going to appraise you or give you, uh, an ample understanding, and also we'll do some real world case scenarios. Okay, we'll do some practical uh, jog outs on this so that you can understand this better. And importantly, why this platform from Salvation is that I I mean I strongly believe, like since last 15 to 18 years where I am in this medical device field. Of course, for a couple of years, I was in teaching profession in NIPA. But it's more, I feel like quality isn't really about the inspection. Okay, it's not that the auditors come and inspect, but it's an insight base. Okay, you should have, if there is no audit also, you should have, the organization should have insight based systems that regulates the quality. And always regulatory affairs is not reactive. Okay, and this is very important when I talk about the regulatory affairs part. It's not that you react for something that is already happened. You need to have a proactive approach. Okay, mainly very predictive approach, like with now the a lot of things that have come in AI/ML platforms. Okay, most of the things you can predict before it happens. Okay, I'll tell you all that mainly in the CAPA or in the improvement process, also in the regulations, the regulatory part, how you can predict that these things are going to happen, okay, before the failure or there is a non-conformance. So the master class here is designed not to inform you, but to transform you and teach, not to teach you clauses. Okay, I can teach you 13485 clause. Okay, there are 8 clause, sub-clause, all this stuff. Okay, maybe I can teach you MDR, there are so many NHR, so many articles, all that stuff. But my idea is not to make you memorize or teach you the clause. Okay, but build your ability to interpret the clause, okay, apply the clause, and define the quality and regulatory principles at a very global level. Okay, it's not just knowing the clause, but we need to interpret them, apply them in your system, okay, and defend them when there is a quality or regulatory, when you are exposed to quality or regulatory global platforms or at a global level. So I would say like the main objectives is like to make you globally competent. Okay, it's not just for one country you are competent or in one section of that you're competent, because I think I have texted you in WhatsApp that of late, it's not that QA is one department or RA is one department or there is another maintenance, all other department wise stuff is gone. It's all interdisciplinary, and it is basically the QARA is very much integrated in almost all countries. And you see that in the UMDR, okay, 2017, that it lot of the NXUs or a lot of the articles that are there in MD are now integrated with the QMS system in 13485, or of course in MD You can see that in US also a lot of the they call it as QSR, quality system regulations, okay, which have been combined with what we call the 510K or the PMA, which I'm going to discuss later. So because of the integrations of the quality and regulatory forms, it is becoming imperative or it becoming mandatory for the quality and the regulatory persons to understand, okay, all the quality and regulatory action. Don't say that I am in regulatory, it's not my duty or it's not my job, okay, to poke finger in regulatory, or regulatory should not say I'm not part of quality or vice versa. You need to have an ample understanding. Of course, your core area remains the same, okay, but end of the day, you should also have understanding on what, I mean, I'll quote a lot of examples on how it can match, or how if it mismatches quality and regulatory, if there is some mismatch, how it can evolve into a non-compliance. Okay. So, I mean, that is the reason why I encourage both the quality and regulatory people. Okay, be strong in your core area, but have ample understanding on the other aspects of the quality and regulatory. And second thing is, please, I mean, know what are the recent updates that are happening. Okay, and try to implement in your system. I mean, basically, QMS is something is a very volatile thing, volatile mercurial. I see 13485 is such a volatile subject that if you read 10 times also, you don't, I mean, you forget the next time. So the best thing for 13485 is not to read it, but to practically do it in your systems, or practically understand it and logically, analytically interpret it, okay, on the shop floor. Whereas regulatory also you need to, I mean, my ambition in this masterclass is to train you to build a global technical file or global regulatory file, not just scattering to the countries piece-wise or in pieces. Okay, you can build a global regulatory file or a technical file that can cater to all the countries, including Europe or US or TGA in Australia or NVISA, even our Cityscope files, IMDR. Okay, of late you see, I mean, a lot of West Asia or in the Asia Pacific, a lot of countries there is improvement, like the SFDA is doing a lot of work on this. Uh, Even embassy in UAE, Saudi Arabia, these are very, very active now. So you should, I mean, as I said, like we'll have the core learning objectives basically on the 13485. Of course, this is the important thing. Apart from the 13485, I'll also help you to map how to do the MDSAP. Okay, as of now, there are 5 countries. There is another 6 or 7 country entering. That's Singapore and South Korea. So there will be 7 countries which fall under one umbrella of MDSAP. So there will be only single audit for 7 countries. Okay, where you can do your regulatory work and export to those countries. And I'll tell you a very simple algorithm or a plan how to work or how to document this MDSAP MDSAP documents, okay, in relation to IS 13485. I know like ISO 13485 is a global standard, global QMS, but every country has their additional or separate quality system, like the US, which emphasizes more on the design controls, okay, like NVISA or the Brazil, which emphasizes more on risk, like the Australia TGA emphasizes more on sterilization and good manufacturing practice. So every country has their own special separate QMS clause which need to be integrated with 13485. Of course, the foundation will be 13485 where you need to build on it. Okay, the MDSAP country wise, I'll help you to do on that. And also, I mean, this is the pillar document for all medical devices. Okay, you may say self-certified class 1 doesn't remind of 14971 risk management. Okay, but risk management is one critical document which is, I could say, it's the heart of medical devices, which is linked to almost all clause or all sections. Okay, and we are going to discuss on that, not by memorizing the clause, by understanding, okay, what auditors seek and how evidence can be generated. It's almost like for everything we need to generate the evidence. It's not like you know the clause and you have done it. If it is not documented, if there is no evidence, it's absolute stupid being in a dustbin. Okay. And the other thing is, the other objective is, and that's what I told, to integrate risk-based thinking. You take any process in your system, in all the QMS, okay? You take any clause or subclause, it is linked to risk. How we are going to integrate risk to every clause, okay, including suppliers clause, including COPPA, including, the management, okay, including the scope, everything is linked to the risk. I mean, that's the beauty of ISO 13485 2006, sorry, 2016. It has linked, and you see this more and more categorically in MDSAP, how there is an interaction between all the processes. Okay, and we are going to learn from all that processes as how they are going to link it. Then that's the risk-based integration of all the QMS and the technical files, even the regulatory files also. I'll tell you the pathway as how to link it. See, your CER is linked to risk, your biocompatibility is linked to risk, your IFU dictates everything on the risk. Even the new GSPR that has come in MDR. Earlier we used to have essential requirements. Now it's a general safety performance requirements which has to be linked. Okay. So it's a risk-based strategy. And to build the capacity to prepare full technical documentation, how to build the technical documentation completely, I said, a complete global harmonized technical file, how to build it, okay? And to navigate through the global regulatory reforms, which in due courses, in due sessions, we'll be navigating to all the global regulatory reforms of almost all the countries, okay? And guys, importantly, I am going to touch upon, of course, it is a subject of my interest, but why I'm taking this topic is for you to understand how the digital and scientific advancements are happening, okay, through AI-driven post-market signal detections. Okay, how the AI is, at some point is going to overtake not all, but some of the predicative analytics or decision making or the digital transformation that is happening even in the clinicals. EQMS is something we talk of maybe some of you are working in UQMS, most of them are still in the manual mode. But like even in the clinicals also, we have the clinical data management, which is interlinked. So at some point you have everything digitalized and everything has to be integrated and interlinked in the digital platform, not that on the paper. So that I will be speaking a lot on toxicological risk assessment in silico systems for of course, as we navigate through 10993 on biocompatibility, many countries are not preferring the in vivo and the animal models. Many are preferring in vitro models or in silico models. Okay, it's software-based models for the biocompatibility studies. That also I'll explain you. Because I mean, there is a separate clause or sections in the CPCA or ALAC which says that if there is already evidence on the biocompatibility studies or the safety in the animal models, there is no need to duplicate by killing the animals and reproduce the data, okay, just by killing the animals simply to prove your compliance. If the data is already available, just do chemical characterization and say that, or toxicological evaluation, and say that the rest of the studies were similar. Okay, of course, you'll have the predicative technical equivalence or biological equivalence or chemical equivalence. Okay, and there is one which is mainly in the SOMAT, like the software lifecycle validation. Of late, there are a lot of software medical devices coming in. Those are the wearables which diagnostics are coming in, which are connected to the Internet of Things, that is IoT. And then there is AI integration where you can monitor from any place. Okay, patient monitoring can be done from any place. That's telemedicine is happening. Okay, telepharmacy is happening. So we need to understand what are the regulations that we need to follow, okay, to compile with this integrations that are happening. Okay, that's basically IEC 62304. Recently, we have done it for our company. Okay, who have these variables. And of course, I mean, guys, I'm telling you, though you may not have EQMS, but at least if your files which have been scanned and uploaded in your softwares, okay, that should have the security, what we call cyber security compliance. Okay, it's not that just you store it in your drives or in the cloud, but how you are protecting your documents. Okay, that is a cyber security. That also will discuss on what are the clause, what FDA is talking, what Europe is talking, what is the general IEC is talking on cyber security. Okay, and at the end, I'll say it's a close loop between quality, clinical, and regulatory. It runs like a cycle. It's, as I said, there is nothing standalone. It's not that clinical is a standalone document or quality standalone or regulatory standalone. These are all integrated. They run in cycle, whether it's clockwise or anti-clockwise. Okay. And most importantly, as I said, I'll be mentoring you in almost in all sessions. There will be some guests mentoring basically on IMDR, that's city scope for Indian regulations. Though I can do it, but I swear, and I'm sorry to say that I'm not I'm not so perfect in IMDR when it comes to some free sale certificates, import, export license, forms, MD, and all that. But I feel guilty about that, not knowing about my country regulations, but I talk a lot about other country regulations and quality systems. Of course, I have invited a guest to talk on IMDR. And one more topic on the Clinicals also. I'm good at clinicals. I'll talk on that, but there will be another guest who will be talking on the post-marketing surveillance and what are the data-driven things that has to be integrated with the PMS. As you know, PMS now has become very stringent, like not only in India, in US and Europe, whether it's customer feedback or PMCF or PSU or periodic safety update reports or your trend analysis, how your traceability is tracking, whether you are complying with the regulatory guidelines in reporting your adverse events within stipulated time to the notified bodies or to the regulatory bodies. This has become very stringent. Of course, the traceability of this. So now we turn complexity. We are in a very complex world. I understand there are a lot of regulations that are pouring in. Okay, last 1 week when I'm reading the regulations, okay, combinedly, I was literally was in a fatigue of regulatory fatigue or quality fatigue. But we'll have a clarity on that. See, some complexity of all these regulations will have a clarity. Okay, overlooking at projecting at a global level. At a global level, how to have the clarity on the regulations. Okay, whether it's quality or the regulatory submissions, how to have more clarity without complexity. Okay, and how can we be very cross-functional? What duties have to do with QA or RA with QA or with other departments cross-functionally, how so that we can deliver it fast. Okay, with deliver it fast doesn't mean that you need to complete it fast with gaps. Okay, you need to deliver it without any gaps, with very scientific vigor. Okay, all that we are going to learn and comply with all these regulations. So I'm here to help you to work on this, to turn this complexity into a very clarity one. Okay. And of course, uh, these are some of my key objectives why I have taken up this master class. Of course, I limited myself to 25 members so that I can have a personal one-to-one interaction with you. I can personalize your profile in my salvation database to monitor and mentor you for next 6 months, like where you are placed or how quick you are going to learn or get promoted or move to the other company in a higher position. Okay, and I will be updating you on the regular guidelines, like how you need to function. So with this introductory note, okay, I think that we need to move fast, but as I said, I won't be teaching you the clause numbers or the clause, the annexure numbers, all that, but I'll help you to interpret them, okay, and how to understand them. Not only interpret, but implement them, and most importantly, how you face the regulatory, whether it's regulatory institutions or it's the notified bodies or it's whether the quality audits, how to face them, what are the major non-compliances that could happen. Okay, that's what I'm telling you. You should be very predictive, have predictive analysis, like what you can expect, where the NCs could come, whether it's just observations, major or minor, whether it's in regulatory or in quality. So with this, if you have any questions, of course, after your introduction and my introduction, we'll navigate into the total course content. After that course content, after navigating into the course content or taking a deep dive into the course content, I want your suggestions, recommendations, like what are the other things which we can connect or which we need to work on. Okay, like as I said, there are very varied cohorts in this. Cohort itself is varied. People with 3 years, 4 years, 10 years, more than 10 years experience, people from different fields, regulatory, quality, some from academics, some in clinicals. So there are a lot of quotes. So let's discuss after your introduction. Of course, most of you I know personally. Okay, I met a lot of you personally, and some I know through LinkedIn or on some conversations. Okay, and for some like Samraji, who is my client, I work with him. I was working with him, and I'll keep continue working with him. I know Priyanka. I know. I know a lot of people, Anil and other ways. Okay, I know Anjali. I know Dolly. We worked with cleanness when Anjali was there. Uh, Anusha, I know Anusha friends. I know Madhusri and Soman. Uh, let's start introducing. And after introducing yourself, okay, just tell me your name. I don't want which place you are working, but just tell me your name, which company you are working. What are the areas areas of your focus or areas of your working place, which areas you are working, and most importantly, what is that you are looking from the master classes, like what other areas you want to learn, maybe in next 1 year or 2 years, where you want to position yourself. See, it's not time. I want to be very open. See, it's not a static thing, it's a very dynamic thing. Any profession will have dynamic. We need to move from one position to other or change jobs, move to other jobs if you are not satisfied. Okay, if you are not having a very healthy work profile in the company, or not giving good important responsibilities. Of course, there will be change in jobs, that I understand. But I want to see all of you after these sessions, after doing the capstone projects, become a better and knowledgeable, energetic, rigorous professionals in the medical device ecosystem or in the field. Okay. Uh, so please introduce yourself so that I can program you on that. uh, on my salvation database. Let's start with Geeta. Geeta is there. Geeta, you can unmute or you can switch on your camera.
Yeah, hi, I'm Selva Gangai. I'm working as post marketing surveillance analyst in HCL. Uh, Previously, I have pharmacovigilance experience. So, yeah, that's it about me.
Yeah, like Geeta, what you want to do in next 1 2 years? Want to be in only post-marketing surveillance, or you are looking at other fields?
Yeah, actually, I'm looking forward for a regulatory role in PMS background. So that is what like I want to upgrade myself and my knowledge in regulatory aspects.
Okay, fine. Yeah, I know you personally. We worked together some time back.
Yeah, we work together.
Next is Abhishek. If I spell the name wrong, please correct me.
Hi, Dr. Vidya. Good evening.
Yeah, good evening.
So, I am Dr. Abhishek Singh. By qualification, I am PhD in pharmaceutical medicine. Currently working as lead regulatory affairs in Healthia MedTech Limited, having overall 15 plus years of experience in
Acha.
different domain. Basically, R&D, research and development in pharmaceutical, then in uh, clinical unit, then in regulatory affairs related to pharma, and now having a medical device experience almost 7 plus years. And currently, our HML manufactures sutures, arthroscopy products, and even our sister company like Quality Noodles Private Limited, we manufacture surgical suture needles. So we are supplying to almost 100 plus countries. Our non-sterile needles.
Okay, great. Abhishek, Dr. Abhishek, I understand that you are almost being in some of the crucial spheres or fields. Uh, and I know Helium very well. Helium earlier was called as Sutures.
Suture India, yes.
Yeah, Future India. I know your MD, I mean, past MD, Dr. Subramanian.
Yes, sir.
Yeah, I
So,
think now.
sir, currently I am based out of Noida. So they have their sister company called Quality Needles Private Limited. So I'm working in Noida and supporting HML for their licensing and others activity, and looking uh, regulatory for QNPL also.
Yeah, that's great. Yeah, I know you have ample experience, but let's, I'll make you to push into more into digitalization, AI, ML, so that you can revamp some of your systems in your organization.
Definitely, sir, looking up forward for all this conversation and giving inputs and taking from you. Okay,
Yeah, and you
thank you.
need to look, as I said, now look at the global harmonization, whether it's in quality or in regulatory, how you go to the global level. Of course, you are exporting to a lot of countries. I do understand you'll have, I mean, plenty of documentation on that. But how to simplify it to navigate it further and make it more digitalized. Okay.
Yes, sir.
Then,
Thank you.
yeah. Yeah, welcome, Bishank, and we'll have a great sessions moving forward. Next is Akanksha.
Good
Akanksha.
evening, sir. My name is Akanksha Deure, and currently I am working at Neuranics Lab Private Limited as a quality and regulatory executive.
Okay, great.
So I'm fresher, so I joined this class to gain more knowledge about regulatory affairs,
Yeah,
so I
great.
can implement in my work.
Yeah, Akanksha, like how many years experience you have in this?
Recently, I joined this company from last 3 months.
Achha,
After
I'm talking of overall experience in medical device field. Total.
actually, I done MTech in medical devices, and after that, uh, I have joined this company since last 3 months.
Okay, great. And I'm pretty sure, as I said, I mean, I'm repeating that somebody like you who are new to this or fresh to this field also, I'll tell you some basic concepts like how you can quickly, enter into this and become from executive level to become a mid level. Okay, later, can foresee like what's going to be your uh, professional journey that's, should do wonders when you go through all these regulations. Of course, again, for all of you, one thing I say that it's it's good that I'm going to, share with you a lot of things. Okay, a lot of templates, standards, forms, XYZ. But I request you, I urge you, okay, to spend at least 2 or 3 hours a week going through them, understanding them, and most importantly, trying to find a way to implement them in your system. Okay, it's not just a question of learning. Of course, we'll work some practical ways how to do this uh, on the online systems, but exactly on the shop floor, I know you'll have a lot of resistance to from the management, or if the management is pro, it's fine, but at least from your hierarchy, how to implement the system, but you should have the PR or HR skills to, move forward. It's not that you can't be an introvert. Okay, next is Aman.
Hello all, good evening. I'm on this side from MedVision Private Limited. So I have overall 5 years of experience, and I initially started my career in one of the CDSA notified body, ICS, and they during the transition period, I had a very good communication with people from different companies, from different medical device background. So I took up all this knowledge from what is DMF, PMF, post-market surveillance, audit, stage one, stage two. From this is where I got all this auditing experience. So I was there as a project coordination, and from there I came in MedVision working as a project coordinator again. Now, after this 5 years course of time, I thought I'll just have a very deep down understanding what actually DMF means, what actually risk management means, what is how to prepare the 11193 documentations, how the applications and overall global documentation need to be prepared and maintained in an organization. So this is my goal objective, you can say, to attend this course, to have a very good understanding of technical terminologies and uh, a basic understanding of to do a day-to-day implementation in an organization, sir. That's it
Yeah,
from my end.
that's yeah. I mean, I exactly understood like what your requirements are, and yeah, so of course we'll work. As I said, we'll have personalized discussions during the course, personalized database, okay, one-to-one discussions. So I mean, as I said, no, there should be some, not some, a great step forward in your career. Okay. I pray and hope that it should happen after these sessions.
Definitely, sir. Yeah,
Yeah.
thank you.
Yeah. Now it's Anjali. Hi, Anjali. How are you?
Thank you, sir. I'm very good. I hope you're also doing well.
Yeah, I'm doing great. I'm just
Great,
before.
sir. Yeah, it was a privilege to connect with you through this channel and on a masterclass. So currently I'm working at Institute of Chest Surgery, Chest Oncosurgery and Lung Transplantation, Medanta, the Medicity Hospital. So I'm
Achha.
working here as a medical writer. So majorly, the major portion is the chest surgery part. So
Hmm.
diseases related to thoracic um, surgery. So
Yeah.
I'm a medical writer here. And before this, I was working at Merrill. So you know my journey. And
Yeah.
before that, I was working as a research associate in Imami Limited. So I have been hardcore into research paper writing, but I have slightly worked on protocols also and PMCF documents also. So I personally feel that this documentation part, I'm not very well versed with it. I'm very confident with the research paper writing part, but I feel it will be a very holistic approach if I learn the regulatory part, the quality management part, the documentation which are actually required for medical device companies. So
Yeah.
it's like I just want to upgrade the umbrella of medical writing where I'm working.
Yeah, that's great. As I said, I mean, Anjali, there will be a lot of things that you can do. Of course, you are very good in clinicals. I've seen you when we are working in clinics with Merrill. So apart from the clinical, apart from the medical writing, you should, I'll in the due course, you'll also learn how to go ahead with CERs, clinical
Yes, sir.
evaluation report, not only PMS, how to write the documentation for PMC of uh, plans and the reports, PSURs, all that stuff, trend analysis. Okay, and I'll in the due course also, in some of the sessions where I'll be taking up on the biocompatibility and on the risk analysis, where you need to link up all these.
Yes, sir.
Okay,
Sure, sir.
and because that is the core for risk-based evidence, that you need to interconnect your clinicals with risk, biocompatibility, and PMS and all that stuff, including copper. So, once you have that understanding, you can keep working in Medanta and also, have a lot of freelancer works or freelancer jobs, like where my company is offering freelancers.
Wow, that that
Yeah,
will be a good opportunity, sir.
yeah. Yeah, take care, Anjali. Next is Anil. Mr. Anil Kumar.
Hello, sir. Good evening, sir.
Yeah, good evening. No rush. Cool.
Fine, sir.
Yeah, fine.
Yeah, good evening to all. Actually, I'm from purely from the teaching background. Sir, already you know, sir. This is my new path, I think. From zero, due to because of you only, I joined this course, sir. For past 10 years, I am in the teaching field. So this is my like new career like that, sir.
Yeah, I know about that. Teaching is a very good noble profession. Even I love teaching. And
Yeah,
I
sir.
really hope like you'll learn a lot of things in this session where you can teach to a lot of people, maybe in your college or maybe you can do a lot of projects on this field of in the sphere for your PG students or PhD students, where we
Yes, sir. Especially
can
for regulatory and pharmacy practice.
yeah, where we can have an MOU and work with your college or whatever is possible. We'll look into that. Okay, but and we'll try to understand and learn some of this.
Yes, sir. Sure, sir. Thank you, sir.
Yeah, then it's Madhusri. Yeah, Madhusri.
Hi, sir. Good evening.
Hi, good evening.
Yeah, I'm Madhu. I'm from Bangalore. I'm currently working in Intuitive Surgical Private Limited, where I'm working for the India CDS for registrations, applications, and pack applications. It's I started my career as a microbiologist, but
Mhm.
later I moved into regulatory affairs in a year. Then there also I was working for the CDS for registration itself. It's a plasma chain where I started my career as a regulatory affairs professional. Then I moved into the Intuitive. It's been almost 8 months here
Achha.
in Intuitive. What I'm currently working is like a skeletal part where I can prepare the documents by extracting the documents which are already available in the global team, but
Mhm.
don't have experience on in depth. Like I have to now what's the reason to register to this course is to dive deep into the preparation of documents of all the DMF, the sections whatever there in the like GSPR and the risk management reports and clinical evaluation report. I know what does the term says and what will be the things have in that documents, but I don't know how to write the documents. And also I'm interested to get the opportunity to work in international regulatory affairs. So I hope this would be the great path to get into there to international regulatory as well. So that's what this is the my pretty things what I can get into this course, reason for get into this course.
Okay. Yeah, good, Madhusri. You have really good clarity and clear on your ambitions. Yeah, of
Yeah.
course. I mean, I'm very hopeful by end of these training classes sessions, you will be independently, uh, you can independently write this documentation because I'll train you in such a way, like I'll give you the templates. Okay, I'll give you already done work done where you can look at how the templates has been formatted and what is the content of the templates and compare it with already filled templates. Okay, and
Okay. Okay.
look at whether it's risk management or you can say back compatibility, and you will also learn the regulations, like how to comply with the regulations and do the documentation. Okay, that's center story. Okay, you need to comply with the regulations and do the documentation. How you are going to comply with this and how your individual writing skills matter, all this will come. But I really appreciate for having so much clarity on what to do next.
Yeah. Thank you, sir. And one
Yeah.
more point which is so attractive is artificial intelligence integration with this. So that is most.
Yeah,
I mean, I felt it.
yeah, I said no, it's very common for almost all guys in this training session that I'm not going to leave you uh, not able to understand, or I am going to make you understand how to integrate this stuff. Okay, whether it's digital integration or AI integration. And the reason is that I foresee next 2 years. Okay, no, in other countries globally, it's happening very fast. The integration, AI integration of digitalization, automation, all the stuff with AI. But obviously, it's going at a very slow pace in India. But next 2 years, I know it's going to pick up. And if you don't know that, and if you keep doing everything on paper and manually, okay, I think you will lag behind the next generation or than that. Okay. Yeah. I'm there to help you on this. Next is Majid. Majid ji.
Yeah, good evening, Dr. Sagar. Good evening,
Yeah.
everyone. I am Majid Sareshwala, currently working as a Chief Scientific Officer at a medical device company called Eon Meditech here in Surat, Gujarat. So, my primary current responsibilities are in research, expanding our company's portfolio in wound healing, hemostatic solutions, as well as ENT-based implants, including oncology, rhinology, and laryngology based implants. Apart from that, I have about 5 years of experience in total in medical device industry. I have closely been involved in product development and regulatory documentation. So
Okay.
basically, my future responsibility is going to include registering all these products which we have developed globally. So I'm looking forward to gain this practical knowledge and basically the confidence needed to manage diverse regulatory submissions effectively. I guess.
Yeah, I do understand. You have to get acquainted with the global regulations.
True.
Yeah, I'll make you understand that. As I said, have total clarity, then make it complex. Okay, once you build the one file, how to navigate to the other file. And if I'm not wrong, Mazid, you are working on hemostats, am I right?
Yeah.
Hemostats.
Hemostats, wound healing, and ENT-based implants.
Acha. What is the material you are using in implants? Hemostats?
Hemostats, we are using multiple materials, including cellulose,
Yeah, ORC,
gelatin.
gelatin.
ORCs, we can also say carboxymethyl cellulose and starch-based materials as well.
Yeah, I got it.
Biodegradable, we can say particularly. Um, in wound management also we are working with semi-synthetic materials, PVA and other materials, stuff like that. And
Yeah,
ENT-based implants, so those are non-absorbable materials. That's it.
yeah, I know. I know a lot about hemostats. Of
Yeah,
course,
you
I
have
have.
past experience in hemostats. I
Yeah,
know that.
yeah, I have few patents and a lot of publications on that. It's okay. I'll be guiding you not only on the quality and regulatory, may help you on some design and development or on the material things.
That would be great, sir. Thank you.
Yeah. Next, Siddiq. Siddiq is there? Yeah.
Hi. Yeah. Yes. So, hi, myself Siddiq. Basically, my profession is biomedical, having the 4 years of experience in EMIMC, medical safety and testing and validation. So, recently I worked at Thermo Fisher Scientific India Pavilion at Hyderabad. Before I worked in the Andhra Pradesh MedTech zone, it's called AMTZ for scientist B. So 4 years I have experience with medical device testing and validation and EMIMC. So main focus to join this course is to upgrade myself as a regulatory. So I have the events of standard testing methods, everything, but the regulatory part I want to upgrade myself. So I have joined this course for that. Thank you.
Yeah, that's sure, Siddiq will discuss. As I said, no, you can see the course content will be covering regulatory from IMDR India
Yeah.
to FDA 510K PMA or TGA, even SFDA, all Brazil countries, Asian countries, Eurasian countries. Okay.
Yeah.
We'll work on that. I mean, the point is that you need to keep yourself updated on that.
Yeah.
Okay. Okay, go ahead. Thank you. Mujid Khan.
Good evening, all. Myself Mujahid.
Sorry.
I'm. Can you hear me, sir?
Yeah, go ahead.
Hello. Yeah.
Go ahead. I
I'm.
spell your name wrong.
Yeah. No issues. I'm Mujahid. I'm calling from Jeddah, Saudi Arabia. I'm working in the Jamjum Pharmaceuticals company since 2012, and basically, my domain is pharma, and we are in generic manufacturing company, and we have some medical devices like sodium hyaluronate and other products. But the basically the purpose of this joining the group and the institute to get the knowledge, and I have overview of the medical device, but in the deep how to make technical files, MDR files, and international markets regulations. This is my purpose. How, and hope your support will be.
Yeah, definitely. See, you'll have a very overview, a bird's eye view of what all this stuff is, and most importantly, you'll have a comprehensive understanding. And third thing is you also will navigate at a very micro level to understand it. So there will be a three-tier system where you can understand at a high level, at zoom out. Okay, then at a mid level, like a comprehensive macro level. Okay, then at a very granular level, like the micro level. So you need to prepare uh, in three-tier system, progressively learning not to dive deep immediately and suffocate. Okay. Anyway, I'll advise you on that.
Sure, sir. Sure. Thank you.
Yeah. Next is Dr. Priyanka.
Hello everyone, good evening. I'm Priyanka. I'm working for Criterion Edge as a principal medical writer. I have over 7 years of experience drafting and reviewing the CRs, the CPs, SCCPs, and the post-market surveillance documents. We are into mainly the clinical documentation for medical devices as well as the IVDRs. I am interested more on the SOMED, and I'm looking forward to get more knowledge on the AI integration and the SOMED especially.
Yeah, good. Because Priyanka, basically, she is my cousin or relative. I know what she wants. I know her experience. Yeah, she is looking more into. I mean, you are looking more into AI, SOMED integrations. Yeah, that as I said, no, I'll be, and guys, to all, in between the sessions, I'll be taking some complimentary webinars. Okay, like say on 14th, I have a webinar on SOMED AI/ML integration, and on 24th, I have a webinar on predicate analysis, data integrity and transparency. So that you can attend it free. Only for you, you can attend it free, but for others, I mean, there will be some participation for others. But for you, these are complimentary lectures. You can attend it other than these sessions. Okay. Then is my colleague or the CEO and Managing Director of Axon Therapeutics, Samradji. Are you there? Samradji?
Yeah, hello Vidya Sagarji.
Hi, Samrat. How are you?
Yeah, fine, and good evening, everyone. I am Samarth. I am the director of Exon Therapeutics. We are a medical device manufacturing company, and we have a cardiovascular products. So definitely, we are looking to expand our product globally, and for that reasons, I joined this course to understand the regulatory requirements. And of course, I believe that Vidya Sagarji is having enough potential to make it very easy for all of us. Thank you, Vidya Sagarji.
Yeah, thank you, Samradji. I'll get back to you later, maybe on Saturday evening.
Yeah,
Okay.
yeah.
To have some personal discussions regarding Exxon only.
Yes,
Okay.
yes. Yeah, sure.
Yeah. Next is Sumant. I know Sumant is from Madhusri company.
Yeah. Hello everyone. I'm Somnath from Bangalore, currently working in Intuitive Surgical Private Limited.
Yes,
And
Somnath. Somnath, I'm sorry. I misspelled your name. You are
no
Somnath.
problem. No problem. No problem. Yeah. I have totally 1.5 years of experience in Indian Medical Device Regulatory Submission. It's called a CDSU. And my expectation in Masterclass is to learn about international regulations like USA, like FDA, and Europe regulations because my future plan is to work on FDA regulations and submitting the FDA regulation doc and Europe regulations. And I want to know about and I want to learn the about ISO 13485 and other standards to know how medical device should comply to it and about the importance. As Madhu said, we both are colleagues. We have like lot of doubts. Like we know the terms called COPPA, what is corrective action, what is preventive action, and we know like they will use the fishbone methodology, and we don't know like how they are using, how they are investigating. These types of many doubts we have, and I'm very much interested in the AI because now everybody is transforming to the AI, and I was last 2 days I was really thinking how we are going to in regulatory, how we are going to integrate the AI, how it is possible. There are many questions in my mind. Yeah, I'll get answer after the 36 sessions, I believe.
Definitely, I mean,
Yeah.
as far as 1348 is concerned, of course, it is been integrated with AI, and also I'll help you to understand more intricacies with the 13485 up to the advanced level.
Hmm.
As I said, mainly on the copper. It's actually when I come to 13485, I'll tell you it's not. As of now, we are not thinking about copper or say corrective action, corrective action, and prevention action. It's more like predictive analysis. Like you need to see, CAPA is more an reactive approach. But
Yeah.
to have a one proactive approach is to take customer feedbacks, but that's not really working. But you can do a predictive analysis of what's going to be your next failure or your next complaint. Okay, that we'll discuss. And also the alignment of AI, integration of AI with the regulatory affairs. It's not that all regulatory work will be aligned with the AI, but basically the post-marketing surveillance, PMS, PMCA of other things, okay, and the CER part, risk management part, okay, and the of course the usability engineering where there is obviously the misuse of a lot of devices, okay, because sterile devices are misused many a times because they re-sterilize and they use it multiple times. That's a misuse. Now we can walk on way
Yeah.
stability of that. Okay. Yeah, then it's Vaibhav.
Hello, good evening, sir.
Yeah, Vaibhav, good evening.
Sir, I completed my master from Naipur, Guwahati in medical devices, and currently I'm working in the Medora MedTech as an R&D officer. Here, I do the research and development regarding the new product development related to the gastrointestinal devices, where we develop the laser cut stent and some endoscopic devices. So the purpose of to join this course is to get more experience in the regulatory affairs, how to make a document, DHF files, and more technical aspects of the regulatory compliance related to the medical devices, and
Okay.
how AI integrated, how we integrate AI with compliance with 13485, and how it be more beneficial to us to get more compliance and stand us to global market. That's the purpose of mine to join this course.
Yeah, definitely, Vaibhav. Actually, what you have seeked or what your ambition is, that all that stuff is covered in our master classes. Okay. Uh, and most importantly, I'll be able to help you uh, to navigate all this stuff in a more professional manner to understand all this. So we'll have a one-to-one discussion on that, and yeah, I'll help you on that. Don't worry.
Okay, sir. Thank you so much.
Yeah. I'm going to create a personal profiles for all of you after this interaction, so that I'll have a crystal clear idea of what you're looking and where you can be placed after the training session or after next 1 year. What could be your exact stance? Okay. And yeah, who is spending? I think most of you, I think Prerna and others left. But before I talk something very important, I want to give a very comprehensive or rollout of the participants' registration analysis. But I said it's nothing great. It's the same analysis which I shared with you on WhatsApp. I think most of you have gone through it. Can you see my screen?
Yes, sir.
Yeah, this is, I'll just run through this in next 5 minutes, because I try to do all the cohorts, analyze all 25 participants, see what exactly are they looking, any changes that can be made in the curriculum or in the master classes. Okay. Already spoke with, there are, what it says is that the interpretation, what I see is that you want to learn the recent updates. Of course, being with the contemporary regulations, what you are following, we need to get into updates like the quality management system or the QSR, which is going to soon align with the ISO 13485. That's a US FDA quality management system. Okay, is going to align with ISO 13485. So there won't be any separate QMS for US. Okay, a lot of things like even MDSAP, and there is like EU risk. I get understanding that you want to get recent updates on that. These are my key findings on snapshot of all this stuff. Most importantly, as I said, okay, a lot of you are from different backgrounds, global high-tech CEOs, Intuitive. Okay, of course, Anusha and Madhusri, Somnath are there from this Healthium, we already discussed, Alcon, Tata Elxsi, Merrill. Others are from different sectors. Okay, some are from service like right on salvation. I think Mayuri has not joined. She is my employee from salvation. Neuronics, so we discussed healthcare providers, academia, Medanta, like Anjali, Ramakrishna Institute of Technology, and this. So we have a different varied, but it's great to teach to varied professionals and to find a common ground on this. Okay, professional experience also, like the new entrants are almost 21%, special 3 to 5, senior is 18%, about 10 years is 22%. So there is also a mix of all this. But of course, the freshers like who has 0 to 3 experience are 31%. Okay. Actually, this is for my understanding, a report for my understanding, just to show you. Like I said, Abhishek want seeking, I mean, this is my interpretation. Abhishek, don't take me wrong. This is my conclusion, like what you want to get in seeking high level strategic oversight for complex global market access, ensuring the RA function aligns with new QMS regulations. Like Samnath, I know about is Anusha. So I already shared this with you. If you want to add anything about this after this discussion, you can post to me in your personal WhatsApp. Okay, and some of them I missed, like for Prerna Sood, I missed. Those who are late entrants, I have missed it. And maybe Anjali, a professional major from a hospital, the RA focus is likely centered on a practical post-marketing vigilance, medical device reporting, and complaint man, complaint handling processes. So this I already shared with you. There's nothing new, but you can add to what I have there. So the overall thing is like there are 3, 4 new things which will appear to you in our discussion. Okay. Most important thing is the alignment of our global alignment of the QMS, whether it's US coming into ISO 13485 or ISO Gen moving into MDSAP. All this stuff will happen in 1 year. Okay. And the SOMET, most of you said like the AI integration with regulatory quality and the SOMET. Okay, the regulatory speed disparity, like how fast it's going to happen, and balancing global requirements with regional focus. No, when you have time, you can go through this. And importantly, I said, like you can WhatsApp to me on some of the things which you want to highlight. Okay. So now we have half an hour. I'll be running through the content, what we'll be discussing, an overview of the content of uh, the all the sessions. I'll run very quickly through this so that, but also I'll be sharing all these documents with you for your understanding, like whatever the standards you require. Can you see this slide? I mean,
Yeah, we can.
yeah, this I already discussed. What are the objectives of these master classes? Okay, what we need to achieve. Core learning objectives is to master ISO 13485 MDSAP audit, not only documentation part. See, master in the sense it's the documentation part, understanding it, implementing it, facing the audits, okay, passing the audits with flying colors without any observations. Okay, audit model and also ISO 14971. Why I kept this is ISO is always 14971 is always linked with 13485. Okay. It's not memorizing clause. Again, I'm repeating, but by understanding what auditors seek, okay, and generate the systems. This also I repeating, it's all integrated with risk-based thinking. Whatever sessions you take, it's all risk-based thinking. You take 10993 or any section of the, if you can apply risk-based thinking. I don't know how many of you know about, I think you would have written risk management files for a lot of products. Am I right?
Yes.
You would have written risk management files or risk management reports for a lot of products. Okay, have you written risk management report of your QMS? Because your QMS also comes into the gambit of the risk management. There could be a lot of things that may go wrong. Okay, in your QMS, any of the clause goes wrong, there will be a havoc. So you need to also write a risk management report of your QMS. That is your 134 on 13485, what you are implementing in your organization. Okay, that you need to adopt or write an risk management report that is called as QRM, quality risk management, which I'll help you to write a QRM on your QMS. It's not just writing the risk files or risk reports on the products or the devices, but also on the quality side also you have to have a quality risk management, which is very, very essential now in all regulations and in all countries, especially emphasizing on Europe and US FDA. Okay, and also to fill on capacity to fill a full technical documentation. Okay, whether it's class 1 to class 3 or could be a SOMAT, okay, or SOINMED, how to do that. And to navigate global regulatory frameworks, all these regulations, whether IMDR, UMDR, FDA, NVISA, PGA, EP, okay, we'll be studying on that. And to explore digital and scientific advancements in QARA, AI-driven post-marketing detection, toxicology in silico, and all this stuff. Okay. Let me come to the actual core architecture of the content. That is the quality management system. We'll have a QMS excellence program on this. Okay. It will be for 32 hours. Covers contents, audits, documentation, metrics, risk integrated operations. Okay. As I mentioned, we will be covering all this and to be benchmarked against MDSAP. I'll also tell you what is the gap, what is the difference between 13485 and MDSAP, how to do gap analysis. Okay, how to do gap analysis between 13485 and MDSAP. Because if you go to a consultant, they'll ask you some dollars to do this, but I'm going to share and make you understand how to do the gap analysis. Okay, and fill the gaps for the other countries that are there in the MDSAP so that you'll have a very global harmonized MDSAP document that is applicable for most of the countries. Okay, you will not only be trained to follow SOPs, but to write, revise, defend them during audits. Okay, writing SOP is really a great skill. Okay, but it's not just to follow an SOP, you'll also have to write an SOP revise, how to revise, defend them during the audits. Okay, includes validation strategies, internal audits. This is very important. I'm going to train you on how to conduct internal audits. Okay, from basic thing to build you on how to become an internal auditor. Okay, CAPA system, supply our audits, risk controls, PMS intelligence. Okay, and on the regulatory affairs, on the global networks, regulatory affairs, okay, again, we'll be mastering on all countries. Okay, I think we'll be involving almost 20 countries, wherein you will have an clarity on which country is focusing on which sections or which clause. Okay, what we call it as mostly is called as country specific requirements. That country specifically want this requirement to be emphasized more than the other countries, than what is there in the regulations. Suppose if you look at EU MDR, you know, like before there were directives, MDD directives, now they have moved it to MDR. And the three concerns are three stress points. Important points in MDR is one is, okay, the traceability where you have the UDAMID UDI that has come in. Okay, there is a reclassification that has come in. Okay, and there is a lot of emphasis on PMS. Okay, of course, PMS linked to clinical. These are the three biggest changes that happened in MDR. So we'll be studying, like say in Canada, what they want, or Australia, what are the country specific requirements. Mostly 70-80%, guys, I'm telling you, will be similar or almost same. So there is a difference between similar and same. So we need to understand what is similar, what is same, and what are the gaps which are not there or which are not available with us, specifically need to write for that country. Okay, that we need to work on. As again, I'm repeating, 60 to 80% to my knowledge, most of the documents will be common. There will be a gap of 20% which we need to understand, analyze, then document it and implement it during the audit so that we cater to everything. Okay, every audits or every country. Okay, and we also learned to build clinical evaluation reports, PMCF plans, biological evaluation reports, including this is the new one which we need to learn a lot. Most of people know that's a toxicological risk assessment in biological evaluation. Okay, technical files, not just to conceptually, okay, but practically also it has to be, you should have evidence to show that you have done this. Okay, not just conceptualizing or having a hypothetical angle. Of course, I said capstone project is something like which you need to build up after learning all these 32 sessions. You will have a capstone project where you need to work on it individually. Okay, develop the project report, which we are going to publish it in a journal, and you will be writing that publication. And I'll also teach you how to write a review article or a research article or an editorial. Okay, what are the skills required and how to format that, and what are the journals which you need to select, and all that stuff. I'll take one separate class and make you to write the publication so that in future you will be okay well versed in writing a review article or a research article. Okay, I said there will be 6 months post monitoring after the sessions. Whatever you want, continuous support for document reviews, audit preparation, regulatory purpose. I'll be doing one-to-one mentoring calls and open QA forms. Okay, once you have done this, I think you should walk away with how to structure, write, defend ISO and QMS documents, able to audit your own system supplies. Okay, suppliers using MDSAP logic, confidentially prepare, review global regulatory submissions. respond professionally to regulatory queries, NC closures, or FDA 483. These are the observations in FDA. Understand how to navigate modern challenges, okay, like the SOMED, TRA, toxicological risk assessment, AML, and post-marketing evidence. Okay, this you can read if you take a deep dive in quality management, what we will be discussing. Okay, just not as a documentation. Okay, risk control. We will be doing a lot of things in 1348. By this document I am going to share you. Please go through this and try to understand what we'll be studying in 13485. Okay, 14971, design and development, process validation, CAPA, supply qualification and material control, in process control, QMS matrix and management review, post-marketing surveillance. Okay, and what are the outcomes after you learn all this stuff? Yeah, what you need to do. Okay, as this the line which I like, 1348 as a living auditable risk-driven evidence document. So you need to document everything. If you have not documented it, it's a very old saying. You have not documented it, which means that you have not done it. So everything has to be documented, data-driven with evidence. Okay, and it should be a live document having regular updates. Okay, this is the regulatory part. We will be discussing on IMDR and all this stuff. UMDR, clinical evaluation reports, biological evaluation and toxicological. Okay, most importantly on TRA toxicological risk assessment. And I forgot to tell you, not only this stuff on this, we'll be understanding for each section, we will be understanding what are the recent updates, current changes that happen, and in future, what it's going to change. Okay, next 1-2 years, what is going to happen with all these regulations? It's 10993 or it's risk management or 13485. You pick up any topic, you should be ready with what's the status now, what are the recent updates, and the third thing is what could be the future changes or the directions, how it's going to move. Okay, the SOMED, FDA, global regulatory pathway of Brazil, Australia. Of course, we'll be covering a lot of countries. Okay, technical gap analysis, cold eye review, like before the audits, how you review. Emerging markets, regulatory like the SFDA, Saudi, FDMEA, GFTA, Singapore, and other countries like Korea, MHOP, the UAE, dossier preparation. This is very important, like the Asiana countries, Latin countries will be covering. So what we will be learning after this session on the regulatory affairs. Go through this, please spend some time on this. Okay. So the capstone project is a proof that you have learned it. If you have done the capstone project very well, it's a proof that you not only heard, you not only learned it, but you are able to practically do it. Okay, that's the reason why I have kept the capstone project. Okay, it shows that practically you are able to deliver it. Of course, there could be some here and there some non-compliances or some gaps. That's fine. We can discuss on that. But for you to get it published and have some, okay, not only the Masterclass QA, Advanced QARA certification, you will have a capstone certification, you will have an internal audit certification, and plus you will have an publication, okay, to strengthen your CV. Okay, this capstone I'll personally guide you. I'll give you a lot of topics where you can choose. Okay, it's not that I will be very rigid for you to take a particular topic, but I'll give you choices to pick up the topic and work on it. Okay, actually I forgot. I didn't have time to talk about my company Salvation Global. Maybe next class I'll have just a snapshot of that on the credibility, competence, and confidence on what you have learned. So over the next few weeks, we'll get together to ensure you are not just qualified, but that you are credible, current, and globally capable. See, globally capable is very, very important. It's not like that you have to be a, a frog in the well, just knowing about your company or just knowing about IMD or CDSCO, but what's happening globally? What are the changes, updates that are happening? Okay. So I'll be sharing all this with you, and you have to give me a feedback. Okay, whether you give a reactive feedback or a proactive feedback, but I want a feedback like which areas you am missing or which areas to cover, or when to have an Q&A session. Basically, I plan after every 1 hour Q&A session. Okay, at 7:30 and 8:30. Okay, and I'll usually take up questions on WhatsApp later. Okay, and I also want suggestions, something like you want it on Friday and Saturday or Saturday and Sunday. Okay, we'll go as per democracy, because we are a democracy, we'll go with majority whether it should be on Friday or Saturday. Because I know Saturdays are really a very valuable time for us. Okay, for our personal life. But I'm happy that you joined. But it's only for, I mean, some of the weeks later you will be having your own independence to learn. It's for your professional growth. And I'm happy that you have sacrificed that. So these are some of the sessions which I'll share. And just to give an ample, I mean, a slight example of what I'm talking. Okay, what I talked since last 1.5 hours. I'll show you an example. Of course, I'll be sharing an example on ISO 13485, which will be starting. Actually, I think I also shared this, but let me make you understand. Can you see this? Can you see this document?
Yes, sir.
Yeah. See, I mean, just to make you understand, like what this is only just a small sample of what we will be learning. Okay, basically, I'm trying to make you understand on the first session, which will be going on ISO 13485 by 2016. How many agree that there will be a revision of 13485 and a new document, a new standard will be coming into 2026? How many of you know this?
Not certain, sir.
Not sure. How many of you know that in 2026 we will be having new 13485 standard replacing the 2016 one? Of course, I mean the last before 2016, the ISO 13485 came in 2003. I know, like after 2003, the main editions were basically on the risk. And before that, it has happened. I mean, it came in 1993. Sorry, 1993. Then in 2003. Then in 2016. And now we are going to have it in 2026. So you have to be prepared, like in the 2026 standard, what are the changes or updates that are going to happen? Are it going to be the same standstill document? Okay, if the changes happen, if the new standard comes out, what are the preparations you need to start doing from now? Okay, how to be more alert and a step forward than the others. Okay, you should not like be one in the crowd. Okay, you have to stand out. You have to be one like a face in the crowd and say that these are things that are happening. Okay, and I mean, just to give us example of what changes that could happen. See, I'm going to tell you in all sections, or whether it's risk management or biological, in biological evaluation, biocompatibility studies, 10993 is which version? 10993 standard came in which year or which version? Those who are in regulatory, they should have known. Or risk management, ISO 14971 came in 2019. Biological evaluation 10993 came in 2018. Okay, but how many of you know that in 2025, okay, there is going to be the new standard that is coming out on biological evaluation, that is 10993 part 1 2025, because that's a new standard that is coming up in this year on biological evaluation, and there will be a new standard that's going to be a big change in the quality management system, that is a new standard coming in 13485. Okay, so what changes you are anticipating, or what are the recent changes that have happened, or what are the future directions that the 13485 committee or ISO committee is maintaining? And we'll also discuss 9001, ISO 901 is a basic QMS for all goods and services, but 13448 is specific specific document for ISO, I mean for medical devices. I'll tell you what is the difference between 9001 and 13485. See, you can raise your hand or hold me if I'm going fast or you're not able to understand. But this is something which, as an testimony or like an example, I'm showing what future we'll be studying. We'll be studying the basic concepts of 13485 and we'll see the updates and the future, like in ISO 13485. Okay. Can you see my document?
Yes, sir.
Yeah, yeah.
Okay, if you see, I'll touch upon what is going to happen, what has already happened or the recent updates, and what's going to happen. Okay, I mean, I also tell the history of this. I mean, in a short, this publication 2016 is the first Korean agenda which has come in March 2016, replacing 2003. So the changes that happened in 2003 and between 2003 and the 2016 document, ISO, is the risk-based process control. Okay, and in 2016, they expanded the supplier management. Software validation has been included in 2016. These are not there in 2003, ISO 2003. Feedback, vigilance, and COPPA integration, okay, with the risk management, these have been introduced, and device life cycle traceability has been introduced. So these are the major changes that happened between the ISO 13485 document that came in 2003 and that has been updated in 2016. Okay, actually, to my understanding or knowledge, after a decade, after every 10 years, ISO 13448 will get updated. Okay, but in between the 10 years, if there are any changes or major changes, they will be added as amendments to it, but a major reshuffle or new standard won't come out. Okay, but if there are a bundle of changes and the necessity to happen that a new standard has to come out, like now what's happening with the 13485, there is a necessity to have a new standard to come out in 2026, replacing the 2016 standard. Okay, and I told you these are the changes that have happened between 2003 and 2016 standard. Okay, I don't know how many of you are aware of 2003. Of course, I am not aware of 2003 standard. By the time I didn't enter medical device field. Uh, okay, and you should also, guys, how many of you know ENISO 13485? How many of you know ENISO 13485? What is ENISO? Yeah, you can type here or you can unmute and what is ENISO? The ENISO is something which is specifically applicable for European Union. Okay, ISO 13485 is such a global standard, but ENISO is something where it is applicable. It's an ISO 13485, but it's EN, okay, which is applicable for the European Union. So what is the difference between ISO 13485 and ENISO 13485 is that the European Union has added some clause, okay, some sections in 13485 that has to be mandatorily adhered, okay, to get or to market your devices in Europe. Okay, if you just follow ISO 13485, you can't meet the QMS of Europe and can't market your devices in Europe. So ENISO is the ENISO 13458 is the standard for the Europe QMS, but it doesn't mean that there will be a lot of changes between these. Okay. I'll just touch upon a few things. There is some issue. Let me do it. Can you see the document?
No,
No?
the previous slide is visible.
Yeah. Is the ISO side visible? ISO 13485 is visible.
Now we are seeing the capstone process integration and output.
Okay, okay. Okay, now you are able to see now.
Yes.
Yeah. Now you are able to see.
Yes, sir.
Yes, yes.
I don't know why it's taking so much time. So I said no. For ISO 13485 is a global document but for Europe, you need to have some additional, documentation, whether you say it's QSPs or SOPs or some integration of documents with the UUMDR. Actually, one of the important point when I say integration of the quality and regulatory is that it happened with UUMDR. When the UUMDR in 2017 came out, it has integrated their lot of regulatory documents with the quality documents, mainly the PMCF, PMS, mainly the COPPA, GSPR, and traceability. Okay, these are basically, I understand these are the sessions that has to be there in quality management system. Okay, but they link these documents of the quality management system with their regulations. Okay, so I'll tell you, as we proceed, I'll tell you what are the additional documents that are required, because most of the Indian companies market their devices in Europe. Okay, and that's for CE marking, and we need to have our ISO 13485 QMS, okay, into ENISO. To get an ENISO certification, what are the documentations that are additionally necessary and how to do that documentation? Okay, that is ENISO, which we will also be discussing. And there are some new amendments that happen. This is also because of UMDR. Okay, this is Amendment 11 that came in 2021. The Medical Device Regulation MDR 2017 and in vitro diagnostics, that is 217 and 746. This is 2017 745 for medical devices. For in vitro diagnostic regulations, it's 746. So what are the new changes that have come in apart from the other changes is they have added annexure ZA, which means correlation of ISO 1348 clause and MDR general safety performance requirements. So you need to link up your ISO 1, okay, QMS 1348 for QMS with the MDR. Okay, MDR is a regulation, it's a regulation, but you need to link up that with the GSPR. Okay, this is very crucial and critical, and many of the companies have non-compliance or non-conformities because they don't do this. Okay, linking up their GSPR from MDR to the ISO 13485. I'll tell you how to do that. And annexure ZB is correlation between, it's the same thing, but it's with IVDR. MDR is medical device regulation. As I mentioned, IVDR is in vitro diagnostic regulation. So this has to be linked. Okay, MDR 2017 has to be linked with ISO 13485. There are some SOPs, QSPs, some documentation that has to be linked. Okay, I'll tell you all those things. Okay, and these have been updated in UU standards references. I think you understood what is ISO 13485 and ENISO 13485. and what are the changes or additional document that has to be submitted. And the greatest thing I have been looking, or many people are looking, that's going to happen this year is the integration or alignment of the QSR. QSR is the quality management. QSR is quality system regulations or quality management system regulations that you see in US FDA. US FDA does not follow ISO 13485. Okay, almost all the countries follow ISO 13485, but US FDA has a separate UMS. It is called as Quality Management System Regulations. I simply call it as QSR, Quality System Regulation, which is basically 21 CFR 820. Okay, 21 CFR 820 is CFR means Code of Federal Regulations. So the game changer here, okay, the imperative, the most happening thing now is that US FDA is now aligning its QSR with ISO 13485. Okay. So once this alignment happens, it's going to happen now, and compliance deadline, as I mentioned, in February 2026. The US QSR or the US QMS system, US FDA QSR or QMS system is going to align with 13485. So there is no need of separate documentation you need to do for US FDA audits. Okay, or manufacturing audits or site audits. Okay, because they are doing this, and it's very glad that they're doing this. See, this is what I meant. 21 CFR 820 is the QSR of US FDA. They are aligning this with ISO 13485, and this is going to happen in February 2nd, 2026. So what's your action plan? When you're preparing your 13485, you need to be prepared to align your 13485 with Europe. Okay, that is ENISO, and with US FDA. So US FDA also requires some additional documentation like ENISO. So you need to understand what are the additional documents US FDA requires. Okay, apart from the ISO 13485, what we maintain now. Okay, I have an ISO 13485 certification. Is it enough? Okay, to comply with US FDA? No. You need to add some more documentation. A few documents. It's not that you need to change everything. Like ENISO, it will be a same ISO 1099, sorry, 134857, but you need to add some documentation. So what we'll discuss is what are the additional documentation required for ENISO, what are the additional documentation for FDA, US FDA, ISO, okay, to qualify for both the countries with one globalized standard of ISO 13485, which caters to Europe, which caters to US, and of course ISO 1348 caters to most of the countries. Okay, so we'll be looking at country specific regulations. That's what I'm talking about. MDSAP, medical device single audit. With a single audit, you can cater to the QMS of a lot of other countries. Okay, this alignment marks a historic convergence in US and international quality standards. Okay, and the new edition is planned. Basically, it was planned in 2025. No, sorry, no new edition is planned. It is going to come in 2026. Okay, plus A11. What is this A11 amendment? Amendment 11 is nothing but the amendments that happened with ENISO. Okay, and the US FDA, they combine all the amendments that happened and make it ISO 13485 2026. Okay, what are the amendments changes happened that they combine it and make it into 2026. So you need to, okay, you need to understand what are the additional things that are going to add in the new standard and how you need to prepare it, how you need to implement it, because 2026 is not very far, it's very near. So you need to understand this. Okay, strengthen the data governance, post-marketing performance, monitoring, cyber security, risk management, okay, aligning with the markets, digitalization. There are a lot of things that are going to happen. So what this means for you, if your organization is currently certified 13485 2000, your core technical requirements have not changed. However, your regulatory alignment, this is what I am telling, regulatory alignments obligations are evolved. So you need to compile with EU and US markets, the new regulations. That is what is happening of late, the harmonization of the quality and the regulatory standards, or the combination or the integration of that, okay, which you practically need to do now. I think most of the people don't know it. Okay, recommended action plans, EU compliance, I told you, you need to be compliant. Okay, Annexes ZA, ZB, which we'll discuss. US conformance, you be conformant is mainly what documents you need to update is a design and develop, complaint handling, copper documentation, record retention and traceability. Okay, for the US need to update that in the ISO 13485. So the global strategy is maintain evidence of harmonized QMS integration. Maintain one QMS. It's not that you keep maintaining QMS for each countries, 20 countries, 30 countries, you'll have a QMS. You have one global harmonized QMS which cater to all the countries and it globally complies and there won't be any non-compliances. That we call it as global harmonization or QMS integration to support audits under whether it's MDSAP or UMDR or USF frameworks simultaneously. And I am going to tell you how to do this. So these are the changes 2026 happen and the recommended actions, how it's going to affect your company, what you need to do now. Well, clarifications on climate change. Actually, there were no changes. This is not, this amendment is not for medical devices 13485. It is for 9001. So don't bother about clarification on climate, amendment on climate change. It is for other manufacturing companies or other devices, not for medical devices. So in conclusion, what we'll do is alignment, integration, and transparency. You need to align with all countries' QMS, integrate them, and provide transparency to everybody. Okay. And I'll tell you how to do this. Integrate that, align them, integrate them, and provide transparency. Okay, country specific, and make it one single QMS document. Okay, one single quality manual, one single QSP or SOP. But your forms and records may change, but the basic structure of the quality manual, quality system procedures, standard operating procedures, standard test procedures, all will be one. But for few, I know like what are the reports that will change. So by 2026, ISO 134 will serve the common global language. Okay. Read these words carefully. The common global language for medical device quality system, bridging Europe's MDR, IVDR requirements and US FDA QMSR framework, a landmark unification that strengthens information quality. Okay, of course, end of the day, quality has to end with patient safety and performance or patient safety and consistency. That is the root cause for all the QMS or what you are talking about quality. So guys, what I'm trying to make you understand here is that this is how we are going to study already existing 13485, what is talking, what are the changes that are going to happen. and what are the future directions that we need to look in. I can tell you for each and every section of, okay, the QMS, whether it's QMS or ISO 1497, whatever standard you tell, we need to be equipped enough to know what's current stage. Are we ready? Are we mastering the current regulations or the documents or the standards and the recent changes, okay, that has happened or that's going to happen, and the future directions, what it's going to do. Okay, and end of the day, it's I always say it's going to be a global harmonization of the regulations or the quality management systems. And the third thing is it is going to become more digitalized, okay, AI integrated digital platforms, okay. And the fourth thing is that it is going to happen very quick and fast. Understood what I spoke? Have you understood what I spoke? Are you
Yeah.
sleeping?
Yes, sir.
No.
Yeah, Madhusri, have you understood?
Yes, sir. Most of the things I've understood.
Yeah, I have just provided an example of one, one part like 13485, what we need to do, what's going to happen with 13485. So for each and every section or every module, we need to going to study in this fashion. Okay. Because
Yes.
when I say we are international, this is an international master class and we are going to study advanced QARA. Again, I am telling you, I don't want to just teach you the class or I want to just read the class and say this is the standard. Of course, that's important. What are the class? How we are going to implement, interpret them. But on the other side of the coin, you need to also understand what is the effective implementation of the clause. Okay, again, I'm repeating this word. I think I'm doing this many a times. The predicative thing. How how fast you are going to predict things, predicate. What are the recent updates, changes that happen? How I'm going to keep that in my document? Okay, what is the gap analysis? In future, I am ready for the future documentation that if ISO, okay, 13485 2026 comes, what you are going to do? Okay, the new standard comes. I am pretty sure it is going to come. 10993, I know the 2025 for biological evaluation is to come. Okay, and there will be a lot of country specific requirements that are going to change. Okay, you know ISO 14974 for the risk management, which has come in 2019, is now integrated with, okay, I know like it's integrated with all regulations, but mainly with the EUMDR. Okay, and EUMDR 14971 and 13485. I'll tell you, very categorically like what sections are interconnected. Because I say that 13485 is built on a concept called PDCA. Okay, PDCA, it's a concept. It's a very old concept, which I don't like or believe. It's plan, do, PDCA.
Plan, do, check, and act.
Plan, do,
Check, and act.
But that's a very old one, which I don't rely on in 2025. It came in, 30 years back. But now it's more on how fast you are able to work on the systems on AML integration, predicative analysis, and all that stuff. Okay, and maybe tomorrow we have a class. I'll be talking in detail on 13485. Okay, and we'll have an Q&A session. I'll also share that some models, test models, mainly on the application part, how you need to work on that. Okay, the updates, how need to work. I said ISO for EN, what we need to do, what are the additional documents. For US, what are the additional documents. For other countries, what are the additional documents. Like say we seen amendment 11. Okay, amendment ZA, ZB. Okay, the amendments that happened with USFDA, all this, how can you build one global ISO 13485 QMS system? Okay, this we'll discuss tomorrow. I'll start with 13485. Of course, I'll discuss the clause also, because I mean, it could be a little bit volatile and mercurial to remember the clause. But I'll sum it up and make it clear for you what to remember, what to, I mean, what not to. And at the same time, I align that with some practical example sessions, which you'll be doing during the session. And also I'll give you an internal auditor training. And most importantly, I'm going to align this 13485 with MD-SAP gap analysis. So I think this may take minimum 2, maximum 3 sessions. So tomorrow I'll be discussing on that, and next 2 sessions, because I mean, why I'm taking more time on 13485? It's a standard, it's a pillar for any manufacturing company. Okay, of course, it's for service-oriented companies. Like Salvation Global is 13485 certified because we are service-oriented. But Axon Therapeutics is a manufacturing company, design, development, manufacturing, distribution. So they have a lot of things to do than a service-oriented company. Okay, so all these things we discuss, and also importantly on the additional things that are there on clause 8, which are very, very important. Okay, supply chain, I mean, clause 8 is about measurement, monitoring and analysis, which includes COPPA and other things. Product realization, okay, the clause 7. And we are also emphasizing more on the supplier evaluation. Of late, there is a lot of concern and stress on the supplier evaluations. Okay, and mainly because of the supply chain disruptions that are happening. Okay, earlier we used to plan supplier audits based on timelines. Okay, after 1 year or 2 years after. There used to be an SOP that says that after 2 years. But now the things have changed where you need to do supplier evaluation based on risk. Okay, not on timeline. So I'll tell you all the changes that have happened recently. What are the new things that have come out in COPPA? As I said, COPPA is no more corrective action or preventive action. It's more a predicative action. Okay, if you are still lying or sleeping with COPPA, I think you will be sold out. Okay, move one step ahead and enter into the new era of predicative. Okay, be proactive. I mean, it's not that reactive. After, like say, after the plane crash, we do the COPPA, but we should interpret whether the plane crash is going to happen, predict it's going to happen or not. After people die and the crash is done, there's no use. So likewise, if the medical device fails and we get it as a complaint, it doesn't look good. Okay. And I'll tell you, I mean, it's not that I'm just using these sentences, but I'll teach you how to do this. How to do the predicative analysis. Actually, there is a webinar on 24th on predicative analysis, but I'll teach you separately how to do predicative analysis. Okay. I think from 20 it has come to 11, 9 people more. Anyway, we'll start it. Study fast. Okay, not slow and fast, study fast. And try to cover 13485. And I want every one of you to understand 13485 from zero, from core to the advances. If you are good in 13485, I think you are going to make a big difference in any company. Okay, and I'll tell you what the changes that has to be brought in, from simple things on scope to the kappa. All of the things we'll discuss. If you are strong in 13485, it will add you a lot of confidence in medical device wherever you are placed, whether you're in regulatory or you're in maintenance or on production. Okay, whether you are in looking into the clinicals, because everything is end of the day is linked to 13485. Of course, even the risk management, biocompatibility, because the quality, even you need to write a quality risk management that is linked. So we'll be learning all this stuff. So make, not only you learn, okay, first learning yourself is more important. Practically understanding visualization is more important in 13485 than having a lot of memory. Don't by heart 13485. Okay, don't try to memorize 13485. Try to visualize and practically understand it. Okay, and after 13485, we'll have a very interactive session, okay, where the non-conformities could occur, how the auditing has to be done, like the internal auditing. So in the next 3 classes, I'll try my best to make you understand well equipped with the good old standard of ISO 13485 quality management system for medical devices, and also make you move into the next standard of ISO 13485 2026, because you have to be as an participant or a trainee in my master class. I want everybody to be 2-3 steps ahead than what other crowds and what other people are doing. Okay, it gives you confidence and also lets you to move faster, okay, with a lot of vigor, with a lot of understanding than the other people, okay, other employees. So we'll close this, we'll call it a day, not a day. We'll close this seminar, this lecture for today, and tomorrow we'll start with 13485. Okay. Any questions? Priyanka, Aman, Amjad, Somnath, Madhusri.
Yeah, no questions.
No,
Yeah.
sir. Thank you.
If you
No,
have
sir,
questions, you can text on WhatsApp. If you have questions, you can keep in the group, or you have something very personal related to your company, you can WhatsApp on my from your personal chat. Okay. Thank you guys. Take care.
Thank
And
you. Yeah.
Thank you so
okay,
much.
sir. Take care. Bye
Yeah,
bye.
good sleep, good night.
Bye.
Thank you, sir.
Yeah, bye.